Hi, everyone. I'm Sarah Smith, Editor-in-Chief of Prevention. And on behalf of Healthy Women, I'm so pleased to welcome you to today's webinar, Back to School Ready, a conversation about vaccines with leading experts and parents. The pandemic has upended our routines, including how we get healthcare. Many parents have delayed routine visits for themselves and their kids, including things like dental cleanings and checkups. But because annual appointments are when so many kids receive their scheduled vaccinations, those who miss their checkups may also have missed vaccines. So you may be wondering about what to do if your child is behind on their vaccines and whether the COVID vaccine affects other back-to-school vaccinations. And there are a lot of buzzy things in the news lately about herd immunity and side effects and the flu shot. There is a lot to manage. As editor-in-chief of a leading health brand and a parent myself, I understand the concerns that so many parents have as we are navigating a new school year shaped by the pandemic. That's why I'm thrilled that we are joined by today's panel of top experts and parents like you. I would like to thank Merck for their support in helping bring this important topic to life. And I hope today's conversation will help answer many of your questions. It's now my honor to introduce today's panelists. Dr. Christina Swiner is a board-certified pediatric primary care nurse practitioner and a psychiatric mental health nurse practitioner. She currently works as a nurse practitioner on the Child and Adolescent Psychiatry Service at C.S. Mott Children's Hospital at Michigan Medicine. And she is the co-chair of the Immunizations Special Interest Group in the National Association of Pediatric Nurse Practitioners and is an active advocate for vaccines. Welcome. Dr. Ada Stewart is a family physician with Cooperative Health in Columbia, South Carolina, and president of the American Academy of Family Physicians. Dr. Stewart advocates on behalf of family physicians and patients to inspire positive change in the U.S. healthcare system. Dr. Stewart has committed her career to ensuring uninsured and low-income families have access to high-quality healthcare. Welcome to you both. We will also be joined in a little bit by a few parents who are going to bring their questions about vaccines directly to these experts. And I'm sure they are questions that many of you in the audience have thought about as well. But let's get started with some important info and insights directly from the doctors. So first, Dr. Stewart, can you explain how vaccines protect against infections? Like, how do they actually work?
So thank you so very much. And thank you for this opportunity to meet and talk about this very important topic. So how do vaccines work? You know, what happens is with vaccines, you have to have your immune system kind of primed up to be able to fight against these viruses and bacterial infections that we encounter. And how we're able to do this is through the injection of either weakened viruses or bacterium, or dead viruses or bacterium, or as with the COVID-19 vaccine, mRNA, which tells our body how to make the spike proteins that surrounds this virus so that when we see it, our body is pumped up and ready to fight against it. So what it does is it looks at what they are potentially encountering and make that antibody to be able to fight. And so as I tell individuals, as I talk about vaccinations, and I hear this every day, you know, about the flu vaccine and about COVID, will I get COVID or the flu when I get immunized? And no, that's not the case, because what we're giving you is something that is either dead or it's weakened, but it is there to work to build up and to pump up your immune system to be able to build those antibodies so that when you do see these particular viruses or bacteria, that your body is ready and able to fight against it. So making it simple, that's how vaccines work.
Thank you so much for clarifying that. I think that's great background for us to have. Dr. Swiner, could you address, though, then that a lot of people sometimes point out that with vaccines like the flu vaccine, that they still got sick. So, Dr. Stewart explained that it's not going to give you the flu, but if people say, oh, but I got sick anyway, so why bother? Can you address that? What's the point of getting a vaccine if they're not 100% effective?
Yeah, so like any medication, vaccines aren't 100% effective, but what they do, like Dr. Stewart was saying, is they allow our immune system to kind of practice. So they see this virus or this bacteria for the first time and build up this security system against this virus or bacteria. So when the person is actually exposed to the disease, our immune system is ready to go. Now, it is true that some people do experience mild side effects related to vaccines, but this isn't a true illness. It is your immune system practicing its response to this infection. So people will often experience things like pain at the injection site or low-grade fevers or being really tired and sometimes a rash. And these are that immune system just kind of fighting this infection and practicing this response so that your body is ready to do it in the future.
And these are things you're saying that happen pretty soon after you get the shot. Is that right?
That is correct. Yep. Usually we see a response like this in the first, 24, sometimes up to 7 days after immunization is given.
What about then when somebody maybe does contract the flu in some way, even with a vaccine? Is it a different flu? Are they getting it just as badly as they would get it before? What happens in that case?
Yeah, so it is still possible, for example, for the flu to contract the flu even if you have been vaccinated. And there's a couple of reasons this happens. First, the flu vaccine is not 100% effective, so it's still possible to get the strain of the flu that was in the flu shot. And going back a little bit, and our flu shots are given yearly because there are different strains of the flu that circulate every year. And we're not 100% effective on which flu virus is going to hit where, but we're pretty good at it and design the flu shot around that. And people can still contract the flu. For people contracting the same virus or strain of the flu that is in that flu vaccine, oftentimes symptoms are much milder and shorter lived than those who have not been vaccinated against that strain of the flu. It is also possible for people to contract strains of the flu that were not included in that annual flu vaccination.
Okay, interesting. Dr. Stewart, back to you. Can you talk about how getting the flu vaccine or not getting the flu vaccine fits in with the idea of herd immunity, which is something we're hearing a lot about with COVID, with some kids not being able to get vaccinated, but I think it's an issue that comes up with flu vaccine as well. What is it and why is it important?
So herd immunity, what that is really getting enough individuals immunized so that that particular virus, such as the flu or even with COVID, does not have the opportunity to really infect individuals. So everyone already has the antibody. Everyone has that shield already because they've been vaccinated. And so these viruses don't have the opportunity to get there. So guess what? They go away. And so if we continue to get everyone vaccinated, either with the flu or with COVID, and with both actually, then the opportunity for these viruses to be able to attack and to get in there into our communities, it's much less. So that's why we talk about herd immunity. That's what has actually happened with many of our other vaccines that we already have, things such as polio and measles. The reasons why we don't see these diseases as much as we do is because we have so many individuals who have that antibody, who's been immunized in the past, that it does not have that opportunity to lend itself to be be able to affect everyone. So again, one of the huge reasons why we need as many individuals vaccinated as we can for all these viruses that we encounter within in our communities.
That's really helpful to think about in that way. And I think it also, most people don't know anybody anymore who had polio or measles, and I know that there's some question around, well, if they're gone, why do we give our kids shots for them? So, Dr. Swiner, would you mind addressing that issue around herd immunity and how it also affects, because I think we should talk about vaccines besides flu. So please.
Yeah. So, for example, for the polio vaccine, and other diseases that we are not seeing as commonly, like measles, it is still important to get those vaccines because we still get exposed to these. There's still international cases, and travel is widespread, and coming back in this setting of the pandemic. So it is possible for people to be traveling abroad and get exposed to these diseases, as well as for people who are traveling here to bring those diseases here. So there is concern that with lower vaccination rates over this last year or so, that some of these diseases will actually start coming back, because we have seen decreases in getting MMR and polio and all of these other vaccines. And we are very fearful that we're going to start seeing outbreaks of these diseases even here in the United States, where we haven't been seeing these diseases as recently or as frequently.
Right. Dr. Stewart, I know with all these recommendations for a number of illnesses now, which can be, devastating if people get them, I know that some parents don't want to give their children all those shots at once. Can you speak to that? Can a child's immune system handle that regular vaccination schedule?
So the answer is yes. A child's immunization schedule is usually based on the science, and so those schedules that are out there that are recommended from the CDC are safe and safe for your child to receive. Those that don't go together are not scheduled together, and we give a lot of information as healthcare professionals to our parents as far as what can be given when, what may not go together. And so it's really important that one acts and speaks to their healthcare professional, healthcare clinician, as far as, the schedule. If there's concern, could my child get the MMR with the DTaP? We have all that information that has been studied for years and years and years, and we have a safety profile out there. And so it's important that you have these conversations, that parents and the healthcare professionals have those conversations with any concern related to what can be given when and what may be an issue. Those things are pretty much addressed in the schedules that are available. And we go through making sure we update these schedules every single year, and making sure that any additional vaccines that we have are added to the schedules. Any that we may have to remove or need to remove are removed. So those things are addressed yearly, and it's really important just to have those conversations with your healthcare professionals, parents, and your clinicians. I always tell my patients that this is a relationship. I'm here to be your guide, to make sure that I hear all your concerns and that we discuss any concerns that you may have so that we can address them based on the science, and making sure that you have all the correct information that you need to be able to make the right decisions.
That's a great point about the, having that relationship, because I've certainly experienced with, a lot of people that I know that they say, yes, I understand all of that, but when it comes to my kid, I have a different worry for various reasons, right? And that's, of course, we all put our kids first. Is there any way to know, if your kid is maybe susceptible to certain side effects, either short or long term? Dr. Swiner, how would you address that if a parent were concerned about that?
Yeah, so in working with these parents who are really concerned about side effects of vaccines, it's a back and forth conversation trying to alleviate some of those stressors and answer those questions. But we really don't know who has a reaction and who doesn't. We do know that overall vaccines are very, very safe, and millions of children are vaccinated every year, and safely so. There is about 1 in 1 million children who are vaccinated who have a severe reaction to the vaccine. But otherwise, they're generally well tolerated with those mild side effects that we talked about earlier for some people, and other people don't have any side effects whatsoever.
And could you address to Dr. Swiner, what vaccines are we specifically talking about when we're talking about going back to school? Like, what are the things people need to be, that they've probably either already checked off or are being hounded to?
Right. Yeah. So a lot of this actually depends on where you're living and what the state laws are. So it varies from state to state. And I wrote some of it down because I know in Michigan what we require, but didn't know what other states required. So I was just pulling out my notes here. So DTaP, polio, chickenpox are required in all 50 states. MMR is required in 49 of the states with the exception of Iowa, which only actually requires the measles and rubella, but not the mumps. Hepatitis B is required by 44 different states with the exceptions of Alabama, Maine, Montana, Rhode Island, South Dakota, and Vermont. And hepatitis A is only required in 17 different states. And these are the particular ones when we're talking about like kindergarten, like entering kindergarten year. So it would be good to talk to your healthcare provider about which ones are required there. And of course, schools also inform you, but again, varies state by state.
Right. And should families expect that their kids will need boosters before they leave school? Like, are we done at kindergarten, or what happens next?
Yeah, so there are boosters for a few of the vaccines. And the reason for that is through studies and knowing how these vaccines work is we know that immunity starts to wear off on some of these things. So we need a booster or a reminder for our immune system how these how these infections work, and we need that protection re-upped again. And so we need boosters for our DTaP. And we even get those as an adult. It's called the Tdap. So, as an adult, we get them every 10 years or more frequently if we're pregnant, right? So they are there to kind of build up that immunity again and protect us. And I guess you could look at the flu vaccine as you get that booster every year. And sometimes it's a slightly different strain, but it's something as well as reminding our immune system, this is how we respond. This is how we protect our body and our health and those around us as well.
That's a really helpful way to think about it. We're reminding our body how to fight these things off. Yeah. Dr. Stewart, what if someone is concerned about the finances around this? They feel they can't afford to get their child vaccinated or have some other barrier like that.
So it's really important that we think about access because, we know within our country there's issues as far as access and cost of medications. But with our vaccines, there are ways to cover the cost. The majority of them are without cost, without any what we call cost sharing to parents through different programs. And each state has different programs available for their children. children for vaccinations, especially for those that are mandatory. So as far as costs are concerned, there are many different ways that is covered, because those things are required. And so required vaccinations usually are free of charge. Some may have what we call an administrative fee that some offices may have, but a lot of times those are waived, and the insurances cover that. So when we look and think about costs, there are a number of different ways to be able to achieve that, taking care of that cost, and that's through community health centers, federally qualified health centers, state vaccination programs. There's so many programs. Health departments, usually give a lot of vaccinations for those individuals who may not have insurance at a discounted rate. And so for that, there are many programs out there. And again, to make sure that one looks at what's available in their area, talk to their clinicians, because we want to make sure that everyone gets vaccinated. And if a barrier exists, we want to remove those barriers.
Terrific. That's great news to hear. Thank you both so much for, starting us off with this really great information. I want to bring in the three parents we have with us today, because I know they have some really insightful questions also. So Pamela Price, Shazima Galani, and Kristen O'Meara are going to join us. Hi, everyone. So Pam, I want to start with you. Will you introduce yourself and then jump in with your question?
Sure thing. Thank you so much, Sarah, for having me, Dr. Swiner and Dr. Stewart, for just the great information. So my name is Pamela Price. I am a deputy director in my daytime job, but I'm the proud parent, my husband and I, to 3 kiddos. We've got an 18-year-old who just started college, and then we have twins who are 7 years old and in the 2nd grade. So obviously this is a topic that is very important to us, as we just returned to school over the last few weeks, and it's all in person. So my first question is to you, Dr. Schreiner. As a parent of a child who has underlying health conditions and they're respiratory related, what do you suggest, or what advice do you give parents who are a little hesitant about some vaccines, especially like the flu, and even with COVID, even though they're not old enough for COVID yet, but when that time comes, knowing that that respiratory system is already under a lot of stress, and so even introducing the amount of virus that may be in the vaccines, that's obviously a concern.
Yeah, sure. So there are different reasons why certain children shouldn't be vaccinated, and for children with underlying health conditions, it's an important conversation to have with your healthcare provider. So different vaccines have, different restrictions. So for example, like you were saying, for the flu shot, for the live flu shot, that kind of is not as safe for people who have underlying health conditions, specifically lung disease. So for your child who has an underlying chronic lung disease, or asthma, something like that, the live flu vaccine should not be given, but you can give the other version of the flu vaccine safely. And for the COVID vaccine, what we do know about it so far is that the individuals who should not be getting it are those who have a history of an allergic reaction to any of its ingredients. Otherwise, it's been pretty well tolerated. And, the studies are still coming out about our children and our younger population. So more information to come on that. But from what we've seen in our older children and our adults, it's been fairly well tolerated in those regards. And then there's other vaccines to consider. So for example, for DTaP, if there's any history of a decreased level of consciousness or prolonged seizures after 7 days from a previous dose, they have a history of seizures in general or Guillain-Barré syndrome, then that vaccine isn't recommended. So having these conversations with your healthcare provider about your child's specific health need is very important. And it's that partnership that Dr. Stewart alluded to earlier in our conversation.
Thank you so much for that. Definitely puts me a little bit at ease with him. My next question is for you, Dr. Stewart. You mentioned and touched a little bit, in terms of that a lot of the vaccines and immunizations, they've been studied forever, their safety, their effectiveness, so there's this long history of having approved vaccines. But when we get to ones like HPV, for example, which we, navigated with our oldest daughter, or even with COVID, are there things that you would suggest that either as a parent, as a healthcare professional, or even as we engage with schools in terms of kind of why there's such a challenge or even maybe a stigma? Hate to kind of throw that word there, but a stigma around, more controversial. Why are some vaccines or immunizations more controversial than others? And what can we as, kind of parents do about that?
So again, it's really important to have those conversations. Things that are new are, are always, what someone wants to know. So, especially with COVID, what could be the potential side effects? Right now, we have been able to administer over 300 million doses, and those have been given safely. No issues. They've been very rare side effects. And, so those things we continue to look at and continue to make sure that we're providing our patients and our families with all the necessary scientific information that they need. Having that is so important. I can't say enough how important it is to have those conversations. I remember with HPV, when it was first introduced and encouraged, the main thing that I heard was that is one encouraging their young person to be engaged in sexual activity. And, we had to kind of talk to our parents continuously, and we continued to learn as the years went on after this vaccine was out there and being used, and kids were being vaccinated, and saw the difference as far as all those things that we were worried about were really things that we did not have to be worried about, and how safe this was and how it prevented cancers and things like that. So we continue to make sure that all information is what I call transparent, that parents know potential side effects, and that we continue to learn and to talk about the advantages and disadvantages of vaccines as we move forward. Talk about those side effects that could potentially be out there, and again, making sure that all information is transparent, and that it's clear, and that we communicate, and that we continue to learn, as we are with the COVID vaccine. We are continuing to learn every day about this, but we know right now, today, millions and millions of individuals have safely received this, and it has decreased the serious illnesses. It has decreased hospitalization, and it has decreased individuals who are dying. And we know even with our children that we are seeing bad side effects and long COVID with individuals who have not been vaccinated. So those are things that we have to continue to have conversations about, and making sure that we are all in this together, and that we are transparent, and that we are continuing to be truthful with everything that we know about the vaccines as we move forward with these.
Wow. Thank you so much. Definitely is. It's a journey. And I think I do believe we are definitely stronger together when we're in this together. And kind of speaking of together, being together, Dr. Swiner, I'd like to come back to you. Again, as a household that has a 11-year age difference between oldest and youngest in the house, what are some things that, just as a healthcare provider, that you can suggest to us, especially when we look at social interactions? Whether or not we go out, if we go out, does our daughter have to self-quarantine? She's away at college. When she visits, do we need to quarantine her? Does she have to wear a mask? Those are things that my husband and I are just constantly thinking about, knowing that we've got this mix of generations, and then we've got partially fully vaccinated and then unvaccinated folks in our home.
Yeah, no, I think this is a challenge that many of us as parents are facing as the vaccine is only approved for, 12 and above, and we're having those adolescents and young adults in different phases of life than our littler ones, and trying to foster that development and life and normalcy in both age groups is really difficult during this time. So the recommendation that I often provide to families, and that I embrace myself with my family, is wearing masks still when you're out and about, and providing that protection not only for yourself but for those you love. You never know when you're out and about who's vaccinated, who's not, who's come in contact with who. And the way I see wearing that mask, even though I'm fully vaccinated, is it's a act of love for my children, for those that I love, and for that stranger on the road or in the store that I just don't know what their background is, and if I'm potentially protecting them, because there's that small chance that I am a carrier, or that I am coming down with a mild case of COVID or the flu or whatever it may be right now, where things are in such a state that we need to protect others, when our hospitals are starting to be overwhelmed with those COVID cases and RSV and influenza, and things are in a dire state. But when you're having kids who have, gone on to college and want to come home and visit and, be with their family and stuff, it's difficult. And families have handled this different ways, whether they've had that individual self-quarantine for a little while, or they go get that COVID test before they come home. They're a little bit more aware of who they're interacting with in the weeks leading up to that trip home. And maybe they're more conscious about wearing their masks or whatever it may be, so that when they come home, they can love on their little siblings and love on their family and have that interaction. And, for those schools and institutions that aren't requiring masks right now, being the parent who sends their kid to school wearing that mask, and having those real conversations with your children of how to protect themselves and how to protect their friends, because they care about their friends, and they care about dad who's immunocompromised, or their baby sister, or whoever it may be. So just making that decision for you and your family, but having your healthcare provider there to guide you with some of this can be really helpful.
Great. Thank you both so much. This has been, again, amazing just to hear again from you subject matter experts out there actually doing this and talking with parents and working with parents. So I really do appreciate it. Thank you both so much.
Agree. It's great to hear. And thank you for those great questions, Pam. We're going to move on and hear from Shazima next.
Hi, everyone. My name is Shazima Gilani. I'm a mother of 2 kids, 13 and 16. I'm also a teacher in Saratoga Springs, New York. My question to you, since I'm an active educator and mom, is, what is the difference between a COVID vaccine and a flu vaccine? And you might have answered that, but is there a way to combine them two?
Well, I'll go ahead and answer that question. Right now, we do not have one vaccine for COVID and flu, but who knows in the future. But we do have a separate flu vaccine and a separate COVID vaccine. And you can get both of those at the same time. And which is something that I encourage. Actually, earlier today, I was able to administer that to one of my adolescent patients. And so, recognizing that you are getting 2 injections, I gave both, one in one arm and the other in the other arm, so that, one arm that's not as painful as the other. And again, explaining to mom and the potential side effects, and also to the young adult, that your arm may be red, it may be sore, you may feel a little bit more fatigue later on. Make sure you drink plenty of fluids after this. But those, we want to make sure that we have covered both viruses, because last year, I think we really dodged a bullet because mostly everyone was wearing masks, was social and physical distancing, was washing their hands. I can tell you within my practice, I had zero, again, zero positive flus last year. Now, this is a new flu season. And we now have the COVID vaccine. We now have individuals who may not wear a mask as often as not. Within school systems, we still have some districts that, are not mandating masks and some are not. So, we still don't know what's out there. And so to make sure that we have protected everyone to the fullest that we are able to do, which is getting that flu vaccine and also getting that COVID. We need to make sure that we do that. And again, that can be done at one time. And again, that's a decision that you make with your clinician. And it's okay to be able to do. There's no interaction, but someone may say, I think I'll just take the one now and get the other one later. And that's okay, long as you get them. So hopefully that answers your question.
Thank you. Yes, it does. This next question is for Dr. Swiner. The question I have is my daughter is actually starting her sports. She's playing field hockey. She's vaccinated, but my concern is that should I be concerned about her heart issues? There is said to be a link between heart issues and the COVID vaccine. Should I be concerned as a parent?
So it's, something that we're aware of and something that we should be paying attention to. We do know that some kids have developed myocarditis following the COVID vaccine. Usually we've been seeing this onset within the first few weeks of getting the vaccine. So watching for signs of, difficulties breathing when she's, just walking around, and any edema or swelling that you didn't notice before. If she's just a little bit more fatigued, easier, watching for those signs. But if she is, out from her vaccine a little ways, she should be in a period of time where she is safe and able to participate in physical activity and get back to normal life as much as we can during these times.
Okay. And my last question is, and then you might have answered this, Dr. Stewart, is what are the long-term effects of the COVID vaccine? And how do you also kind of persuade others to get the vaccine, to kind of add to that?
So we still don't know the long-term effects. Right now, we are about 8-9 months into the beginning of people receiving the vaccine. And thus far, we have not seen anything significant. Again, these are things that we continue to learn about. We have to make sure that we're transparent in anything that we see as far as potential effects of the vaccine. But thus far, it's been safe, it's been effective, it's saving lives. And so it is very important that we continue to encourage everyone to be vaccinated. I can tell you that the most important thing in how I talk to my patients and their families about the vaccine, about the COVID vaccine, is that I want to make sure that any questions that you have regarding that it's addressed, that we talk about it, that we address all your concerns, and make sure that, some things I may not even know, but I'm going to look that up. Or I'm going to direct them to reliable sources such as the CDC. And it's a learning, we're, as was said, we're all in this together and we're all learning.
Definitely,
and
yes.
again, as clinicians, we are that guide. We're those trusted resources. It's important for us to make sure that we give all the information that we can to help our parents make good decisions and the right decisions for their child.
Thank you. That was really helpful as a parent and an educator. Thank you.
And just to add a little bit to what Dr. Stewart had said, she mentioned that we don't know the long-term effects of the COVID vaccine. We're still studying that, and we haven't seen any long-term effects. But I can tell you, we have seen long-term effects from COVID, an actual, infection with the COVID virus. And these can be really long effects. We've seen things such as cardiac failure months after having a COVID vaccine, long-term fatigue, headaches, ADHD developing after a COVID infection, psychosis, like lots of really long-term things that we just don't know how long these last. We don't know necessarily when they may crop up after these infections. And I mean, just in the last 2 months, I've worked with kids who were previously healthy, came down in COVID, and now need heart transplants. Like, it is really scary. And if we can provide any level of protection against this virus, the COVID vaccine is the way to do it. And wearing those masks for those who can't be vaccinated yet.
Absolutely. Thank you.
Thanks, Dr. Swiner, for reminding us that the virus we know has long-term effects, and we're still learning about the vaccine, but the safety is has been shown to be great. So thank you all again. And so let's hear from Kristen now.
Hi there. Thanks for having me. My name is Kristen O'Mara. I'm the Special Education Director at Chicago Charter School. I have 3 daughters, also a set of twins, age 9, and then an older daughter who's 11. When my children were really young, I chose not to vaccinate them, but I've since changed course and have kind of accidentally become a vaccine advocate. And so my questions are sort of from the perspective of someone who might have some vaccine hesitancy that goes a little bit beyond just, questioning, but, some concerns that might lead them not to vaccinate. So that's sort of the frame of mind that I'm coming from. So my first question is, some parents might be thinking that so-called natural immunity, so like immunity that you get from actually contracting the disease, is more robust, like a stronger immunity than vaccine-induced immunity. So for example, like, why get my kid vaccinated from chickenpox? I might as well just let them get that. That's a mild disease, and then they'll be immune for life. And, I think I'm hearing some of the same things about COVID. Kids are not affected as seriously as adults are. So let's just have them get the disease and get it over with. Dr. Stewart, what is your take on that frame of mind, that way of thinking?
So thank you so much for asking that question. And it's really important because I recall those times when, parents would, if one of the children had chickenpox, they would bring them all, make sure they all kind of gather up together and get it. We know that immunity, even with the vaccine, can wane. We know that does not last. And also just think about the impact of that disease. Even with chickenpox, years ago, it was pretty much considered a mild infection, but now individuals can die from chickenpox. And we know the impact that COVID can have. And we know that even those who have gotten COVID, they can get a reinfection of COVID, which can be much worse. We know that we've seen various strains of COVID, including the highly contagious Delta variant. So those individuals who may have gotten COVID early on may have gotten the Alpha variant, which could have shown up as a mild infection. But later on, they can get reinfected with another strain that could be more deadly and more contagious. And so those are things that we really want to avoid. We don't know, and we've seen right now that the infective antibodies that one gets, those wane fairly soon. And with the vaccine, we know that that immunity that you get from the vaccine lasts so much longer, and it covers much more of these variants that we're seeing. And even if one has a breakthrough infection, it has tended to be mild. Individuals don't end up in the hospital, nor do they die. So we don't want to take a chance in having someone just, take a chance in getting an infection and potentially dying from that versus getting the vaccine and having a much more sustained immune response.
Thank you so much, Dr. Stewart. That makes a lot of sense. My second question, a lot of people are worried about how quickly vaccines are produced and approved. I think especially with the COVID vaccine. And they're worried about what ingredients are in vaccines in general. Dr. Swiner, can you talk about vaccine safety a little bit, including maybe touching on the preservatives that are used in vaccines? Because I know that's often a hot topic among people who are concerned about vaccine safety.
Yeah, no, so every ingredient that is included in vaccines serves a purpose. So there are preservatives in some of our vaccines, such as thimerosal, which is found in particularly the multi-dose flu vaccine vials that we administer from, and this is to prevent contamination. This preservative is also found in certain types of fish, and it is different from the methyl mercury that causes mercury poisoning that builds up in the body. So this agent does not build up in the body like that does and is excreted from the body. There's things like aluminum salts that are in vaccines, and these help boost the body's response to the vaccines. And there are things such as stabilizers. These are often sugars that help keep vaccines effective. Some vaccines also have remnants of like egg protein, and this was used to grow enough virus or bacteria to create the vaccine in the first place. So there's no extra stuff in vaccines, just the stuff we really need to have in there to keep vaccines safe and effective.
Awesome. Thank you very much. My final question is for Dr. Stewart. Do you have any advice for parents if their children have fallen behind on the immunization schedule? I know that was the case with me when I decided when my kids were out of infancy that it was time to change course and vaccinate. And so we did, a catch-up schedule that was based on CDC recommendations. But especially with people falling behind because of just the lockdown and everything, do you have any advice for how someone would go about getting caught up on vaccines?
So thank you. It's really important that as soon as one has the opportunity to get their vaccinations done, we need to do so. There are, as you said, there's schedules out there as far as catch up. There's a way to do it, and your primary care clinician will help you to make sure that is done in the correct way, because there's a way to do the catch up. There are certain things that can't be given altogether, so we may have to schedule that out. But that's something that you will work with your clinician to make sure that that's done properly and in the safest way for your child. But the most important thing is we need to get everybody in and get them vaccinated as soon as possible. The doors are opening up. We are now making sure that there are safe ways for children to get into the offices so that they can receive their vaccinations. And sometimes we may have to, go outside the box. Some of the offices are now opening on the weekends to make sure that we're able to help you as parents get these children in, get them vaccinated so that they're safe and they can be able to, have a more normal life as we move forward.
Thank you so much.
Thank you so much, Kristen. Those are great questions, all of you. I am sure the doctors join me in thanking you for those really important questions. And I know we all thank you for the insightful answer. So this has been such a great conversation. And I think we've really covered a lot of issues that are concerning to parents. But before we end today, I want to give each panelist a chance to give us one final piece of advice or recommendation that we can take away as parents. So Dr. Swiner, why don't we start with you?
Yeah, of course. So I kind of want to take this moment to talk about getting the COVID vaccine and even the flu shot from a little bit different of an angle. So I work primarily in mental health right now, and I've seen this pandemic from a completely different side than most people have. And the toll that it has taken on the mental health of our children and adolescents is significant. I've seen increased suicide rates. I've seen increase in eating disorders, depression, anxiety, and the list goes on. And I mean, we could talk for hours about this, but getting the COVID vaccine, wearing your mask, getting the flu vaccine are all ways for us to get back to normal and help us address these mental health crises that are now emerging in astronomical rates than ever before. And it provides another intervention for us to help these children in a different way than just protect their physical health.
Thank you. And Dr. Stewart, a last brief word from you.
Yes, and thank you. That's so important. So I'm glad you mentioned that. But you know, the most important thing that I would like to have everyone go away with is vaccines are safe, they're effective, they save lives. And we really have to make sure that we recognize all of that. You know, I love our academy, and we have something that I love to say is that, you know, vaccination is a selfless act of prevention, and it helps us to build that community, again, community of immunity. And so it's really important as we close today that we recognize how important vaccinations are, not just the COVID vaccines, but all the vaccines, for us to be able to continue and not have the stressors that we have had this last 18 or so months, and be able to move out of this public health emergency. So again, thank you for this opportunity, and I really appreciate the parents being able to be here today with us.
Thank you for that very important final thought. So on behalf of Healthy Women, I really want to thank all of you so much for participating. And once again, thank you to Merck for their support of this roundtable. And for more information to our audience, please visit healthywomen.org, where you can find more content on vaccines and on keeping you and your family healthy. Thank you, everyone.